Asthma, a chronic disease of the lungs, is the most common chronic childhood illness in the United States. With 1 in every 10 children in New York State living with asthma, it's likely that you will care for a child with asthma at one time or another. Every child in your program who has asthma should have a care plan that talks about how to take care of the child, even if the child does not get medication. Triggers can be things that irritate the child's lungs, such as an allergen, or extreme emotions, like high anxiety. The triggers that start asthma episodes are different for each child. Things that trigger one child's asthma would not bother another child. You can help by knowing a child's triggers and avoiding them to reduce the child's risk of having an episode. A cold is the most common trigger of asthma in young children. You can help reduce the risk of children getting sick by washing your hands, cleaning and sanitizing toys and surfaces, and encouraging parents to talk to the child's healthcare provider about the flu vaccine. Let's go to Ken Scallon, the Director for Lung Health Services with the American Lung Association, for more information on asthma triggers.
Asthma triggers. And on this particular chart, for example, in the home setting, we can see a pet, we can see dog hair, cat hair, we can see, and here's one I'd like to really emphasize, tobacco smoke, because that is a critical factor, and too many people don't realize that when they're smoking around children, the damage that they can do there. We have to really get people who do smoke to recognize they have to take it outside, they have to take it away from the child. They can't be doing that. I've heard daycare personnel say, gee, when the children came in this morning, I know whose parents are smoking because I smell the smoke on the child's clothing. So that's very detrimental. We can talk about spray products in the home and the fact that some of those things will irritate the child's breathing. I mean, some of those things irritate ours when we think about it. Perfume that people may be using or colognes can be irritating factors. Exercise induced that I mentioned earlier. Well, children involved with that may have to pre-medicate to prepare themselves for that. So that's yet another trigger. And nature provides us with many triggers, in the outside setting. We're talking about pollen production, different times of year. We're going to have different types of production going on. We're going to have grasses at some part of the year. We're going to have trees at some part of the year. So those are factors that have to be watched very closely. I think dust is a common factor. All of us are guilty of having perhaps dusty homes. And what we really have to be careful of there is how much dust is around, how often we're cleaning, and trying to really eliminate that dust. If we have, and an awful lot of homes do have this, wall-to-wall carpeting, that's really something that we say you can't afford to have if you have children with asthma or family members with asthma. You really need to look at having area rugs, for example, and being sure your floor is kept clean.
Ken mentioned exercise, pollens, and grasses as triggers. For children whose asthma is induced by these triggers, check with the parents for how their child can best participate in active outdoor activities. Keep your program clean of mouse droppings, cockroaches, mold, and pet dander, as these can also trigger episodes in children. And remember, cold air, changes in temperature, and high humidity can also trigger asthma episodes in some children. Talk with parents about the best way to dress their child to help reduce exposure to triggers while outside. Studies have shown that when triggers are reduced or eliminated, asthma symptoms and the need for medication also decreases. But even with your best efforts and careful avoidance of triggers, a child may sometimes have an asthma episode while in your care. Talk with the parent to know what triggers the child's asthma. Write this information down in the child's asthma care plan. Sometimes children will start with mild symptoms that happen before an asthma episode. Being able to spot early warning signs is helpful because it can allow you to take quick action. Early action may decrease the seriousness of the attack or even prevent an asthma episode from happening at all. Early warning signs are different for every child, so knowing each child's specific early warning signs is important. The child may first experience a change in behavior, such as nervousness, have a stuffy or runny nose, become tired, have watery eyes, or have a cough. Since children under 3 often lack verbal skills to describe their symptoms, be sure to watch for these early warning signs. Remove the triggers if you're able, and check the child's care plan to see what you should do to help minimize the asthma episode. Some children may use a peak flow meter to see if their asthma is under control and to know when to take the medication. A peak flow meter is a small handheld device that a child blows into to determine how well his lungs are working. Each time he uses the peak flow meter, he will get a measurement or a reading. If the parents have given you one, make sure you know how and when to use it, and you document it. Let's go back to Ken Scallon to explain what happens during an asthma episode.
When we talk about what asthma is, I think we need to take a close-up of our lungs and our bronchioles. And if I turn and look at this chart here and I look at the lungs before an asthma episode, we can see the air sacs, we can see the tube in the airway, we can see airflow occurring here, nice and smooth. We see the muscles around there, and they aren't constricting it. Now if we move down and we look at lungs during an asthma episode and we see that the muscles have tightened up, you can see the banding here. You can see the airway itself is swelling. So it's constricting the airflow in there and making it more difficult for the person to breathe. And in these smaller ones, when the muscles contract, the airway narrows and it plugs with mucus. And as a result of that, it's very difficult for people to breathe. They have to expel that mucus. And if they have difficulty expelling it, then there very obviously are going to be problems, and that's where medication comes in.
Every child feels differently when having asthma symptoms, but most often they will have repeated coughing, wheezing, breathlessness, and chest tightness. If the child is acting agitated or scared, breathing rapidly or differently, wheezing, can't stop coughing, having trouble breathing when lying down, sitting with shoulders hunched over, or if the child is unusually pale, remove the child from any triggers and follow the instructions in the child's care plan immediately. If the child does not improve or gets worse, the first thing you should do is care for the child immediately and remove any triggers. Help calm the child and then give asthma medication. Let the child's parent know immediately that you gave him medication. If the child does not get better, call 911. Many children with asthma need to take medication. There are 2 types, controller and quick relief or rescue medication. Controller medication helps manage asthma and can prevent asthma attacks. Some children may need to take medication on a regular basis to prevent an asthma episode. Others may only need medication when they are having an asthma episode or to prevent an exercise-related asthma attack. These medications are called quick relief or rescue medication. They work quickly to relieve asthma symptoms, but do not control airway inflammation or sensitivity. There is no cure for asthma, but with proper care, it can be controlled. That's why it's important for you to be prepared. Talk with the parent, find out about the child and what triggers his asthma so you can be prepared to take care of him, helping the parent feel more comfortable leaving him in your care.